Hello students, in today's video we are going to study pharmacology of tetracyclines, their mechanism of action, antibacterial spectrum, pharmacokinetics, uses and adverse effects. Now tetracyclines are antibiotics. Now antibiotics are the drugs that are used to treat bacterial infections. Now very important, tetracyclines are active against a wide range of disease-causing bacteria, and thus these are termed as broad spectrum antibiotics. So tetracyclines are a class of broad spectrum antibiotics. Now these antibiotics are bacteriostatic. That means they inhibit growth of bacteria. They prevent the growth of bacteria. Now antibiotics included in tetracycline class of antibiotics are as follows. The first is tetracycline itself. So tetracycline itself is an antibiotic, and this entire class of antibiotics is named as tetracyclines class of antibiotics. So the first member is a tetracycline, then oxytetracycline, dimeclocycline. These belong to the first generation of tetracyclines. Then doxycycline, minocycline, these belong to the second generation of tetracyclines. Now look at this figure. This is the structure of tetracycline. Now basic structure or the basic nucleus of all these antibiotics consists of 4 fused cyclic rings. Now tetracyclines are obtained from various species of Streptomyces bacteria. Now oxytetracycline was obtained from Streptomyces ramosis. Others like tetracycline, doxycycline, minocycline are obtained semi-synthetically, and doxycycline is the most commonly prescribed tetracycline. Now in addition to this conventional tetracycline class of antibiotics which are obtained naturally or semi-synthetically, there is a new class of synthetic tetracycline analogues named as Glycylcyclines. Now tigecycline is the antibiotic in this class. Now let's understand mechanism of action of tetracyclines. Now tetracyclines inhibit bacterial protein synthesis. So look at this figure. Now this first figure shows a bacterial ribosome. This is the bacterial ribosome, and it consists of 2 subunits. This is the 50S subunit and this is the 30S subunit. Now this is messenger RNA. Now messenger RNA attaches itself to the 30S subunit of the ribosome. Now these are codons on the messenger RNA. Now a codon is a group of 3 nucleotides. Now each codon codes for a specific amino acid. So now this complex is termed as messenger RNA ribosomal complex. Now 50S ribosomal subunits has 2 sites, the P or peptidyl site and A or the acceptor site. Now as we all know, proteins are made up of amino acids. Now this is the nascent peptide chain that is being formed, and this nascent peptide chain is attached to the P site. Now at this stage it has 3 amino acids depicted as 1, 2 and 3. Now this nascent peptide chain elongates with the addition of more and more new amino acids to form the required bacterial protein. So now the next amino acid, that is the 4th amino acid, is transported to the A site of ribosome by a specific transfer RNA. So this 4th amino acid is also added to the growing nascent peptide chain. Now tetracyclines bind to 30S subunit of ribosome and they inhibit attachment of this amino acyl transfer RNA to the acceptor A site of bacterial messenger RNA ribosomal complex. So, since they inhibit the attachment of this transfer RNA, they also prevent transportation of this new required amino acid. So, this peptide chain, it fails to elongate. Bacterial proteins are not synthesized, and thus tetracyclines inhibit bacterial protein synthesis and they exhibit bacteriostatic action. That means they do not allow the bacteria to grow. So, the bacteria is unable to grow, the bacteria is unable to replicate. So, this is the mechanism of action of tetracyclines. Now, tigecycline also acts by the same mechanism. Now, let's study antibacterial spectrum of tetracyclines. Now, tetracyclines are broad spectrum antibiotics as they are active against a wide range of bacteria including gram-positive cocci, then gram-negative cocci, gram-positive bacilli, gram-negative bacilli, spirochetes, all rickettsia and chlamydia. In addition to this, they are also active against protozoa at high concentration. So, gram-positive cocci like Staphylococcus aureus, Streptococcus pyogenes, then gram-negative cocci. Now, tetracyclines are active against a relatively few Neisseria gonorrhea and Neisseria meningitidis. They are effective against gram-positive bacilli like Propionibacterium acnes, Bacillus anthracis, effective against gram-negative bacilli like Vibrio cholera, then Yersinia pestis, Helicobacter pylori, Brucella. Now, important to remember that gram-negative bacilli that are not inhibited by tetracyclines are Pseudomonas aeruginosa, then Proteus, Klebsiella, Salmonella typhi, and many Bacteroides fragilis. Now, tetracyclines are effective against spirochetes including Treponema pallidum and Borrelia burgdorferi. Now, they are effective against all rickettsia and chlamydia. So, all rickettsia and chlamydia are highly sensitive. Protozoa like Entamoeba histolytica and Plasmodia are inhibited at high concentration of tetracyclines. So, this is the antibacterial spectrum of tetracyclines, and tetracyclines are the broad spectrum antibiotics that inhibit protein synthesis. Now, let's study pharmacokinetics of tetracyclines. First is absorption. Now, all tetracyclines are absorbed orally. Now, absorption of first generation tetracyclines like tetracycline, oxytetracycline is better if taken empty stomach, while second generation tetracyclines, that is doxycycline, minocycline, are completely absorbed even if they are administered in the presence of food. Now, first generation tetracyclines like tetracycline, oxytetracycline, they have a shorter half-life of 6 to 10 hours. While very important, doxycycline and minocycline, they have a longer half-life of 18 to 24 hours. Now, tetracyclines are chelating agents. They form chelates. They form chelates with calcium and other metals like, for example, they form chelates with iron, magnesium, and the formation of these chelates prevent absorption of tetracyclines. So, tetracyclines should not be consumed with milk, iron preparations, antacids, etc. Then distribution. Tetracyclines are widely distributed in the body. Now, tetracyclines show poor penetration in the cerebrospinal fluid. But very important, minocycline. Minocycline is the most lipophilic drug. It penetrates cerebrospinal fluid in therapeutic concentration, and therefore it is used in the eradication of meningococcal carrier state. Then metabolism. Majority of first generation tetracyclines are not metabolized, while second generation, that is doxycycline, minocycline, are partly metabolized. Then excretion. Tetracyclines are primarily excreted in the urine. Now doxycycline. Doxycycline is primarily excreted in the feces. So very important. Doxycycline is the exception here, and doxycycline as it is excreted in the feces, it is preferred in patients with renal dysfunction. So this is in brief pharmacokinetics of tetracyclines. Now let's discuss uses of tetracyclines. Now since tetracyclines are broad spectrum antibiotics and are also associated with a range of adverse effects, their use is restricted, and therefore tetracyclines are used only for those infections for which a more selective and less toxic antimicrobial agent is not available. Now, doxycycline is the most commonly prescribed tetracycline. Now, let's discuss those indications where tetracycline is still preferred. Now, doxycycline is the drug of choice in Rocky Mountain spotted fever. Now, Rocky Mountain spotted fever is a bacterial disease that spreads through the bite of a tick infected with rickettsial bacteria. Then doxycycline is also preferred in the treatment of Lyme's disease caused by infection due to Borrelia burgdorferi. It is a disease that is characterized by rashes of bull's eye pattern on the skin and flu-like symptoms. Then tetracycline therapy is also effective in the treatment of atypical pneumonia caused by Mycoplasma pneumoniae. Then cholera. Doxycycline along with the fluid replacement therapy is effective in the treatment of cholera caused by Vibrio cholera. Then doxycycline is the drug of choice in the treatment of brucellosis. Then tetracyclines are highly effective in the treatment of bubonic and pneumonic plague. Then topical tetracyclines are used in the treatment of acne. Then tetracyclines are very effective in the treatment of venereal diseases or sexually transmitted diseases. Now doxycycline is a drug of choice in the treatment of chlamydial non-specific urethritis. Urethritis is the inflammation of urethra, and also in endocervicitis. Endocervicitis is a condition in which there is inflammation on the inner lining of cervix due to chlamydial infection. So in both these diseases, doxycycline is the drug of choice. Then tetracyclines are also preferred in the treatment of lymphogranuloma venereum. Then they are also effective in the treatment of granuloma inguinale due to the infection by Calymatobacterium granulomatis. Now, as already discussed, minocycline is lipophilic, and minocycline is the only tetracycline that penetrates cerebrospinal fluid. So, minocycline is used in the eradication of meningococcal carrier state. Now, in addition to this, demiclocycline is the tetracycline that antagonizes antidiuretic hormone. So, demiclocycline antagonizes ADH action, and thus it is used in the treatment of syndrome of inappropriate antidiuretic hormone secretion. So, these are the indications of tetracyclines where tetracycline is still preferred and used. Now, let's understand adverse effects of tetracyclines. Now, first adverse effect is the gastrointestinal upset. Now, tetracyclines possess irritant property. So, irritant property of tetracyclines can cause epigastric pain, nausea, vomiting, diarrhea on oral ingestion. Now, in addition to this, especially with doxycycline, if the doxycycline is released from the capsule while swallowing in the esophagus, then it can cause odynophagia, that is the painful swelling of esophagus, and esophageal ulceration, that is ulcers in the esophagus. This is due to the irritant property of doxycycline. So doxycycline, when comes in contact with the wall of esophagus, it causes odynophagia and esophageal ulceration. Then another adverse effect is the hepatotoxicity. Now, high doses of tetracyclines can cause fatty infiltration of liver, that is storage of extra fat in the liver, and can also cause jaundice. Now, very important, risk of hepatotoxicity increases during pregnancy, and this can precipitate acute hepatic necrosis, that is the death of the liver cells, death of hepatocytes, and this can cause liver dysfunction, or this can even result in liver failure, and thus tetracyclines are contraindicated during pregnancy. Then kidney damage. Now, all tetracyclines except doxycycline enhance already existing renal damage. So, they should not be used in patients with kidney disease. Now, in addition to this, outdated or expired tetracyclines, they can cause damage to the nephron. They can cause damage to the proximal convoluted tubules of the kidneys, which can result in Fanconi syndrome. Now, tetracyclines can also cause phototoxicity. Now, what is phototoxicity? Now, in phototoxicity, sunburn like severe skin rashes or severe skin reactions occur when the body comes in contact with the sun rays. So, when the body comes in contact with the sun rays after consuming tetracycline, this can result in phototoxicity. Now, phototoxicity occurs because the drug or its metabolites in the skin absorb UV radiations. Now, very important, higher incidences of phototoxicity have been observed with doxycycline and demiclocycline. Then adverse effects of tetracyclines on teeth and bones. Now, as already discussed, tetracycline forms complexes with the calcium, and this calcium tetracycline complex deposits in the developing teeth and the bones. Now, if given during pregnancy or to children below 8 years of age, tetracycline can cause brown discoloration and ill formation of teeth. In addition to this, it can also cause temporary suppression of bone growth in children. So, that is why tetracyclines are contraindicated in children below 8 years of age, in pregnancy, and also during lactation. Another adverse effect is pseudotumor cerebri. Now, tetracyclines can cause increase in the intracranial pressure, and this can produce central nervous system symptoms like headache, blurred vision. However, it's reversible on stopping the drug. Then very important, as already discussed, demiclocycline antagonizes action of antidiuretic hormone, and thus it increases volume of urine. So, it has been used in patients with inappropriate antidiuretic hormone secretion. Then vestibular toxicity. Now, vestibule refers to the inner ear that is primarily associated with the sense of balance. Now, very important, vestibular toxicity can occur with minocycline, and it can cause ataxia, that is poor muscle control causing clumsy movements. Then it can result in vertigo, that is dizziness. Then nystagmus, that is rapid involuntary movements of eye. Now, very important that this vestibular toxicity, it subsides when the drug is stopped. Then hypersensitivity reactions can occur with tetracyclines but are infrequent. Now, very important, tetracyclines are broad spectrum antibiotics and they kill the normal, healthy, defensive microbial flora of the gut. So, this can result in super infection. That means this can cause growth of pathogenic opportunistic organisms in the colon like Candida albicans, then Clostridium difficile, and growth of these pathogenic opportunistic organism can result in excessive diarrhea. So, these are the major adverse effects of tetracyclines. Now look at the contraindications of tetracyclines. Now, as tetracyclines specifically cause teeth discoloration, then ill formation of teeth, then temporary suppression of bone growth, they are contraindicated in children below 8 years of age and also during pregnancy and lactation. Now, during pregnancy, risk of hepatotoxicity also increases with these drugs. Now, as tetracyclines are excreted in urine except doxycycline, they are contraindicated in patients with renal failure. However, doxycycline can be given cautiously as it is excreted in the feces. Now, as high doses of tetracyclines cause hepatotoxicity, they should be cautiously administered in patients with hepatic failure. So, these are the contraindications of tetracyclines. Now, in addition to tetracyclines class of antibiotics that are mostly semi-synthetic, there is a new class of synthetic tetracycline analogues, and this class is glycylcycline, and tigecycline antibiotic belongs to this class. Now, tigecycline is a derivative of minocycline. It is a broad spectrum antibiotic and its mechanism of action is also as of tetracyclines. Now, in addition to bacteria that are sensitive to tetracycline, tigecycline is also active against most bacteria that are resistant to tetracycline, like MRSA, that is a methicillin resistant Staphylococcus aureus. It is also active against vancomycin resistant Staphylococcus aureus. Then it is also effective against vancomycin resistant Enterococcus. Now, since antibacterial spectrum of tigecycline is broader than tetracyclines and its toxicity is also high, tigecycline is approved only for treatment of serious and complicated infections in hospitalized patients. It is used in the treatment of community acquired pneumonia, then treatment of complicated skin and skin structure infections, then treatment of complicated intra-abdominal infections caused by enterococci, anaerobes and enterobacteriaceae. Now, another important feature of tigecycline is this, that like conventional tetracyclines, tigecycline is also not active against gram-negative bacilli, that is Pseudomonas and Proteus. In addition to this, it is also not given orally and it is administered by slow intravenous infusion. It is widely distributed in the tissues while its concentration remains low in the plasma, and it is eliminated in the bile. So, dosage adjustment is not required in patients with renal insufficiency. Now, tigecycline has a long duration of action and its elimination half-life is 37 to 67 hours. So, in addition to this, adverse effects of uh, tigecycline are more. In addition to the adverse effects of tetracyclines, tigecycline can also cause pancreatitis, and it is also not recommended for children and during pregnancy and also during lactation. So this is in brief on pharmacology of tetracycline and tigecycline. Please note, information provided in this video is only for academic informative purpose. For use of tetracyclines or for the treatment of infections, consult your physician. Now, antibiotics should always be consumed in consultation with the physician. If you find the video useful, kindly like, subscribe and share this video. Thanks for watching this video.